Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon, founder of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're going to talk about a very serious topic, actually, one that I think functions almost like a public warning, something that I've been talking about for years, but it's starting to get some traction, and I'm hearing it from other surgeons as well, which I'm very happy to see some collaboration and some awareness coming to this topic, and that is the concept of filler fatigue, or filler burnout as some describe it. And basically what this means is the following. There's a point where adding fillers to the face begins to do more harm than good. And the lines have been extremely blurred over the last 20 plus years since fillers have become very, very popular. And for the consumer who does it a little bit at a time, one or two syringes every 6 months, a few syringes here, a few syringes there, over time, almost like compounding interest, over time, there's some pretty profound changes that are happening to the skin, and they are not good. And they're happening to the soft tissues, which are even more damaging. So I'm gonna bring some of this to light. I'm gonna explain to you what I'm referring to, how you can keep yourself out of this mix, how you can do something about it, hopefully now, and what to look for. And this is what it comes down to. And I'm gonna share a story with you. Literally last week, I was operating on a patient, and she was a typical out-of-town patient of mine, so I got to meet her in face-to-face shortly before the procedure, and we go off to the surgery. Now, normally, I don't get into a full-blown filler history because my assumption is that most patients that I operate on have had some interactions with fillers, have had some fillers placed throughout their face, and this woman was in her early 50s. I'm in there, I start doing the vertical restore, getting into the tissues, and suddenly I just see this gel-like substance oozing out of the tissues, down around the jawline, up around the cheeks, and it's like fresh filler. I mean, gel-like fresh filler. And because we do these procedures under IV sedation with local anesthesia, I'm able to ask patients questions during the surgery, and they're able to give me coherent answers. And so I asked her, I said, when was the last time you had filler put in your face? She said, the last time was like 5 years ago, but I did a lot of it before then. And so it was amazing that 5 years later, in the very tissues, was this fresh oozing filler coming out. I mean, literally, it's almost like you can press on it and it would ooze out of the tissues like a sponge. We know from MRI studies, we know from experiences, and this is, believe me, not the first time this has happened, I mean, countless times. We know the fillers actually don't completely go away. And the reason why they don't completely go away is because natural hyaluronic acid that is ubiquitous in our tissues. It's the joint fluid, it's in our skin, it's lubricating fluid all over our bodies. In its natural form, the cells are constantly making it, and it's constantly turning over, meaning that it lasts for about 24 hours or so as a molecule. But you couldn't put that into the tissues to volumize the face because it's all gonna disappear. So what do? You synthetically cross-link hyaluronic acid. Cross-linkage is a chemical process of bunching a bunch of these together in long chains. And that evades, for the most part, the body's natural breakdown process and allows these fillers to last longer. It also, depending on how it's done, gives the different consistencies. For example, Voluma is harder, Restylane Silk or Volbella is softer. Like these are all alterations of the cross-linking properties of hyaluronic acid. Now, this is where it gets interesting. We are under the assumption that they begin to sort of disappear to the point where you can't see clinical effects by 6 months to a year in most cases. But what that means is that if you think about it as like a tip of an iceberg, right? If you start at the floor of the ocean, you build this iceberg up, and just at the tip is the only part you can visually see if you're standing on the surface. Well, if you're looking at the surface of the skin, and you're looking for shape change because of the fillers, volumetric changes, you have to put a lot more down in the deeper tissues to get the surface to start to actually manifest a change. But what happens is, let's say you lose 15-20% of that volume, Well, all you're doing is you're losing the amount that you can see on the surface, but it doesn't mean that the stuff that's below the surface is all the way gone. So what ends up happening is that you get filled, you're looking great, you've liked the way it looks, you're like, oh, this is the best thing since sliced bread. Then 6 months later, you lose a little bit, you're starting to see your appearance start to change back to normal again. And then you're like, okay, now I'm gonna go in and I'm gonna put a little bit more. So hence you go in 6 months later for another filler. The filler injector happily puts it in, agrees with you, you look like you're back to baseline, puts more in. Now, instead of working at an empty base, you're starting to put volume on a semi-filled base. So now you get actually more volume, more change than you got the very first time, right? Because the first time, 80% of it was in the deep tissues, 20% of it was showing change. Now you're putting it on that base, so you get even more physical change on the skin. So you're like, yes, this looks really good. Well, guess what? Your eyes start to get used to it. You start to, you wait again and you get a little bit of a loss, your appearance starts to change, you're back. So it becomes a cycle. And a cycle that leads to year after year after year. And you can imagine, a lot of people start this stuff in their 30s, right? Full-blown facial aging takes place in their late 40s, early 50s. You can just see how the amount that you used in your 30s is only gonna get significantly more by the time you're in your late 40s and 50s, because you've got a lot more real estate to start to shift and move, because now you got jowls, you got neck laxity, you got sagging of the nasolabial folds, hollows under the eyes, you got a lot of stuff that's happening all at once. And so the demand on the filler goes up, you start putting more and more of it in. But here's what's happening at the tissue level. Because it's not completely going away, it starts to create congestion in the tissues. It means that the normal lymphatics, normal blood flow, normal exchange of all the different, it's just something that doesn't belong in the tissues is putting physical pressure in the tissues. You start to see diminishing fat pads, you start to see cheeks that never existed before, fullness that never existed before. You start to see widening of the jawline because you're trying to get rid of jowls and you're putting it all down in the lower half of the face to kind of like fill this way and fill the pre-jowls, and all of a sudden you got a jaw of a linebacker. And then you're like, wait a minute, I'm starting to see things aren't, I'm starting to age, I'm getting heavier, my whole face is looking heavier now because you've got all this volume in there that has never gone away in the last 10, 15, 20 years, has not completely gone away, and you built upon it. And the face starts to sag, which naturally makes the face look heavier. Now all of a sudden you've got an extra heavy looking face. And it's a problem. It's a real problem because now when you put everything back, even if you do a surgery, well, the soft tissues are not what they used to be. They don't look the way they used to be when you were 30 because you've had 15 years of even 20 years of stuff that's been added to it that hasn't gone away. So the whole thing is different than it was before. And your desire, all you want in your mind and all you've always wanted in your mind is to look the way you did when you were in your 30s, because that's how you envision yourself. That's how we all envision ourselves. And now you get a surgery and it's not exactly what it was before, and you still have these kind of like overfilled jaw lines and unusual looking cheeks and all this kind of stuff. But it gets worse. In that same patient I told you about the other day, and I don't think there's any way the patient would know who I'm referring to, but the tissues were so friable. I'm used to I'm in the deep plane in a very stout, heavy, soft tissue base. So when I grab it, it's like sturdy. I lift it, it holds suture. It's amazing. I mean, one of the best things about operating in the deep plane is that you have this type of tissue to work with. But in this case, I mean, her platysma muscle literally was being shredded. The sutures that were being put in were not holding well, but it was all infused, all congested with filler. There's definite changes that happen to the soft tissues with time as a result of these fillers. We see them commonly in people also who have them underneath the eyes. I think you all can probably appreciate, many of you have this experience. You put fillers under the eyes time and time again because you're actually trying to overcome a bulge that you have which should be treated surgically, like a bag under your eye, and you're just filling it to kind of get to that point. But the next thing you know, you've got these heavy bulges under your eyes from the filler, but then something unusual is happening too, is the skin is starting to get kind of crepey and thin looking, and yet the skin around your cheeks and everywhere else looks really good. So there's There's all these sort of physiologic changes that are happening. Once you arrive at this stage, the term I guess that's being thrown around is like filler burnout or filler fatigue. But this is the point here. Fillers are foreign bodies. Don't let anyone tell you otherwise. I drank the same Kool-Aid. I called it a natural product because it was hyaluronic acid. But hyaluronic acid, when it's cross-linked, is no longer natural. For the reasons we mentioned, your body's trying to constantly break it down. It doesn't always get to do a good job with it. It gets encased in the local tissues. The tissues aren't able to completely break it down because it can't even reach, the inflammatory process can't reach it. The other areas that it reaches it, it does become scar tissue, and scar tissue becomes sticky. And that's the other thing is any surgeon who's listening to this, any surgeon who has any experience with this knows when they're operating in faces who've had fillers put into it, the tissues become very sticky, like scar tissue creates that environment. So all of this can simply be avoided in a very easy way. Number one, recognize that the use of fillers, it's not your anti-aging bullet. That's not the way that these fillers are designed to be. In fact, we all thought, including myself, that this was kind of the silver bullet. Everyone can benefit from it in that kind of way. We know now after 20 years that laxity cannot be treated with fillers. So don't go in there time and time again putting in fillers into the air. Use it sparingly, a little bit in the lips, maybe a little bit in the temples to top things off. Areas that are really kind of good for fillers are like temples, the lips are pretty good. Pre-jowl area, a little bit down here, just a small amount is good. But use it very sparingly, no more than like once a year and a half or so. But if you have laxity, meaning if your soft tissues are starting to fall forward, at any age, I'm talking any age, even if you're in your 30s, and you have what looks like jowls, or you start to see your midface starting to pull down and you're trying to use filler to fix those problems, you're gonna fail. And you're gonna fail miserably, and you're gonna have all these other issues that we just talked about. So what has to happen in these cases is you actually have to have surgery. Simple as that. I mean, there's no way to sugarcoat the scenario. I mean, we've tried it for 20 years one way, realized that it's not the way to go. We've gone full circle. Surgery is the only way you're going to get laxity back up. Forget the devices, forget the Thermages in the world, and the Ultherapies of the world, and the Morpheus 8s, and all those kind of things. That's not going to do it either. And those of you who've tried those things really know that if you have even mild to moderate to severe jowls and laxity, it doesn't even put a dent in it. That's a whole other problem. We've had videos speaking about those consequences as well. So recognize, if you have laxity, surgery is your answer. A vertical orientation of the lift, like the vertical restore prevent that I perform. Obviously, I believe in it. That's a technique that you use. But look around and find surgeons that can give you that type of an effect. Don't waste your time, money, and more importantly, don't ruin your tissues with the use of fillers over time to correct those type of problems. Fillers have a very, very small place, smaller than we've ever considered before. They have a place, but use it with caution, understand the consequences, and see what road you're heading down. And don't chase this idea of being very full all the time, because that's not what looking young is about. In fact, volume has almost nothing to do with looking young. And if you want to challenge that, look at 20-something-year-olds at a college town, wherever you go, and you'll see tons of flat mid faces, tons of hollows under the eyes, but you cannot mistake the fact that they're 20-something-year-olds because they have facial shape that's youthful, and they have great skin. Those are the two foundations of youth. Volume plays little role in terms of making somebody look more young. It has a big role in making somebody look less tired, especially around the eyes. So keep all that in mind. Guys, I really hope this hits home. I hope for many of you who are starting to kind of head down this road, you approach it with a little bit more caution. And for those of you who are already there, again, it's never too late. Just recognize where you are, just stop everything, and at some point in time when you are ready, have surgery, treat the facial aging changes properly, the way they're meant to be treated, and you'll be overall good to go. Just recognize that some of those changes may be there even after surgery. All right, folks, I hope this really helps. Like I said, please send this along to some friends and family. Let's get the word out on this. This is something I'm very passionate about, and I certainly want the best for you guys. If you haven't already, subscribe to the channel, like it if you enjoyed this video, and any questions, and I'm sure this is going to stimulate lots of questions, drop them in the comments below. I'll do my best to get to as many of them as I can. All right, folks, thanks so much. Dr. Amir Karim.